Hello, this is Talking Europe, France 24's weekly appointment with European decision makers. Now, we have all seen the figures. The COVID-19 infection rate in Europe is growing rapidly once again. 20 million people around France are beginning nightly curfews now for at least the next 4 weeks. And tens of millions more people around Europe are coming to terms with new restrictions on their daily lives. So we are diving into the latest statistics, the latest advice with Dr. Andrea Ammon, who is the director of the European Centre for Disease Prevention and Control. Dr. Ammon, thank you very much for joining us.
My pleasure.
Just a first question then about the second wave. We spoke about this last time I interviewed you. I think we can say the second wave is absolutely here in Europe now. Do you have a prediction of how long this is going to last at this sustained level of high infection rate?
Well, I think that is something that we cannot say right now. All the countries are taking measures to curb a further increase. It will take 2 to 4 weeks until these measures, the effect of these measures can be seen. And all these measures are taken in order to make sure that the increase is coming to an end. But how long it will take overall, I cannot say.
Now, there's been a lot of effort put into setting up test and trace operations in the various states around Europe. With this higher rate of infections as we're seeing right now, can test and trace operations really have a tangible impact, or are there just too many infections now?
Well, what we are saying is that these measures that are now taken alone will not help to control the increase. They have to be accompanied by extensive testing and contact tracing. So yes, we think the combination of those two strands of work will actually is necessary.
If we just look back a little bit at how we got here, of course, the second wave was very much predicted by people, including yourself. But why has this growth in infections happened seemingly so rapidly? Is it, would you say, because of people returning in great numbers to offices, universities, countries being too quick, perhaps, to try and get us, quote, back to normal in terms of dining in restaurants?
I believe it's not only one factor or one driver here. Indeed, countries have expanded their testing, which of course leads to more cases being detected. And that we could see in the beginning of this increase, that was some point in June, July, August, where the case numbers were rising, but the percentage of tests that were positive was staying the same, which indicates that the increase is more related to the increase of testing. But that has changed now in the past few months, where we see actually the percentage of positive tests rising. We see also that the percentage of notified cases that are among younger people, that was higher at the beginning, is still there, but now also the number of infections in elderly people and the number of hospitalizations rise. And that is a clear sign that there is more ongoing transmission. As for the reason, of course, we assume that the fact that people could meet finally after the strict measures in March and April were released a bit, might have contributed to the increase.
Now, it is quite hard for lay people such as myself and many of our viewers who aren't scientists to understand all of the statistics and figures that are coming out. Some people have been saying that it seems like the virus is less deadly or less strong than it was in the spring. Is that what you understand?
There is, from our side, no evidence of this. As I said, through the expansion of testing, more people in younger ages were tested that were not included in the test regimes in March and April. And these age groups have a lower probability of severe disease, although they also can get severely sick and even die. And that, I think, led to a lower rate of hospitalization rate numbers, which are now interpreted as that the virus is less aggressive, but that's not the explanation.
Something else in terms of understanding the virus itself, do we have a better understanding of whether people who have had and recovered from this virus are actually safe from getting it a second time? For example, the US President Donald Trump famously said that he's now immune to coronavirus.
It seems that most of the people develop antibodies that signal that the body has had the infection, and a high percentage also keeps these antibodies for months. But we haven't, the observation time is not yet long enough to make a final statement for this.
So if somebody's had coronavirus and they've recovered from it, you'd urge them perhaps to proceed with some caution still?
I would still recommend that until we have really the certainty that they're protected.
I'd like to go back to the containment measures, which are really ramping up here in France, elsewhere in Europe. Do you have an assessment of which containment measures are the most effective? For example, here in Paris and in 8 other urban centres around France, as I said, around 20 million people are facing nightly curfews for the next 4 weeks. Other places locking down entire towns and cities. Some places simply closing their bars and restaurants earlier than normal. Do you have an assessment of which are the most effective?
Okay, so any measures that reduce the assembly of a lot of people closely together will be likely reducing the transmission, because the virus is transmitted from one person to another. So what we know is that keeping a physical distance is really the safest measure. Now, that's not everywhere possible. So in these circumstances where it's not possible, we recommend to wear face masks. And the problematic part of assessing which of the measures are really most effective is that they're usually applied in a package. And so it's very difficult to see which measure is really the most effective. But any measure that really reduces people gatherings is something that may reduce the transmission.
Another aspect of many people worrying about travel. The European Centre for Disease Prevention and Control, as you know, has just issued a new map of Europe that we can show to our viewers right now. It shows areas which have greater and lesser prevalence of the virus currently. The intention of this map to allow member states to better coordinate restrictions in terms of travel between those states and freedom of movement. There is a lot of red there on that map. Should we perhaps just stop travelling internationally for the time being?
Well, the maps depict the epidemiological situation. So the epidemiological situation is one element. The other element is that, of course, when you travel, you are in contact and are in places where you meet other people. And that is, of course, a potential risk for transmission. We have actually, together with the respective agencies, like the Air Safety Agency, the Railway Agency, and the Maritime Safety Agencies, come up with protocols and guidelines how to reduce the risk when traveling by air, train or a cruise ship. So and the measures in principle are the same. Keep your distance, wash your hand, and wear a face mask if you cannot keep the distance. I mean, the measures don't change.
And I'd just like to ask you one very difficult question to finish. Do you have a prediction of when we will be able to move on from this coronavirus, get to a point where it no longer disrupts our lives?
Well, I think everybody hopes that to be soon, but that will not happen. It's a completely new virus for basically the world. So in principle, everybody is susceptible. We also would not assume that as soon as a vaccine is available, that the measures can be sort of dropped right away. So it will depend on what kind of vaccine it is, how much it's available, and how effective it is. So we are most likely in the position to deal with this virus for, well, at least a year or maybe 1.5 or 2.
All right, perhaps too early to say with any great certainty, but thank you so much for speaking to us once again, Dr. Andrea Ammon.
Yes, right now it's really very difficult to predict.
All right, thank you so much for your time, Dr. Andrea Ammon, Director of the European Centre for Disease Prevention and Control. And thanks to you for watching the programme. Hope to see you soon here on France 24.